Another topic we'd like to address here on First Edition has to do with those first couple of weeks back in class illnesses our kids tend to pick up. We are talking about cold, strep throat, and pink eye, just to name a few. Dr. Greg Silverman joins us live with what to look out for and how to prevent them. Dr. Silverman, this is kind of the bane of every parent's existence when it comes to their kids going off to class. They're so excited, but then they don't come home with homework. They come home with something that makes them sick.
Good morning and welcome to Parenthood 101 is basically every adult's nightmare, which is my kid has a fever of some sort, now what do I do? And there are a lot of classifications of this, either from headaches to fevers, there's sore throats, there's inner ear problems, there's hand, foot, and mouth disease, which is another type of virus, all these other types of small types of viruses that you get from hanging around other kids, in addition to the types of small little bugs that you can get, is sometimes you get lice from other kids as well. So there's a lot of things to be careful of out there.
So what's some good preventative care to take? Does that involve sleep and proper eating?
Yeah, the best thing is to put your kid at school healthy as they can be. The other thing is to make sure, and I think that after COVID, I think people are a little bit more aware of this. If your kid has a fever or your kid has something else, don't send them to school. I know it's very, very difficult not to send a kid to school, but don't send your kid to school if he's got a fever or when your kid is sick. Don't do that to other kids around you.
And so one of those things, maybe calling your doctor too, just to double check, or what would you recommend?
Well, that's a really good question. It's like, when do I take my kid to the doctor? When is it that? And generally what I would say is if the kid is lethargic, if there's some sort of a mental status change, if there's a fever that's been going on for more than about 3 or 4 days that you've been treating with appropriately and you think this ought to be better by now, and if there's very, very high fevers that are not affected by any type of sort of anti-fevers like Tylenol or ibuprofen, if you get one of those and you just can't bring the fever down, maybe it's time that you started talking to your physician.
Dr. Silverman, as always, we appreciate your insight and your input. Thank you for waking up so early to be with us. We'll be checking back in with you next Monday. If you have a question for Dr. Silverman, go on and send us a text at 361-855-6397.